Welcome to the City of Toronto's COVID-19 media briefing for Tuesday, May the 5th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mr. Mayor.
Thank you, Brad, and good afternoon. And at the outset, I just want to take a moment, as much as we spend most of our time, of course, as people would expect, fighting the pandemic, to take a moment to highlight the work that continues in other areas at the City of Toronto. Since the beginning of the COVID-19 pandemic, the City has worked hard to continue to deliver the critical and essential services you've heard us refer to so often and that are part of the day-to-day life of both running a city and also living in one, and I believe the City has done that. The City has also, of course, with all the team here and many, many people who work with us, I believe very effectively dealt with the emergency as best we can, which has confronted the City. But also, we've supported the continued carrying on of business to the greatest extent possible while protecting the health and safety of both residents and employees across the city. The City has been able to implement rapid process changes, including technology deployment, to allow a number of online and in-person services to be offered, supporting individual residents and other important sectors like residential home improvement projects and the building industry, both of which employ in total thousands of Torontonians. We recognize that despite the pandemic, in fact because of the pandemic, we needed to be agile and to find ways to address in particular the city's housing challenges, to keep construction of housing going and support our building industry, and in turn support the city's economy. Our ability to pivot quickly during the time of the pandemic has resulted in providing development approvals during the time of the pandemic for more than 6,600 housing units, issuing close to 2,200 building permits with a construction value of over $900 million, conducting final construction inspections and providing occupancy permits for more than 2,000 new housing and commercial units across the city. These are important things that all happened between March 16th and May the 1st as we confronted the virus, but they were crucial to increasing the supply of housing, including affordable housing, and to keeping people employed. These numbers reflect a strategic approach to making sure that city business continues to get done. Staff prioritized developments that would have a significant impact and were at critical stages, such as ones that were, for example, about to start construction, ones that were proceeding through final technical clearances, and ones that were very close to occupancy. They also reflect how we're embracing technology so that we can keep important projects moving forward. We've initiated virtual community consultations, with the first one being Housing Now, a project at 705 Warden, and that will take place on May the 13th. We're having pre-application development meetings via web conference, something that we haven't done before, and we're accepting development material and building permit applications online, something we haven't done enough of. We've found ways to do things differently and often much more modern ways using technology. That's something we were pushing for before the pandemic. It is something we have done even faster now because of the pandemic, and I fully expect, as I believe residents and businesses expect, that we will keep this modernization going as we move into the recovery period. This week, I know people are starting to look forward to that recovery period, knowing that we have more work to do. But their patience with the lockdown-type restrictions is getting much thinner, and we understand that. They are seeing other areas, other geographic areas that were hit earlier by the virus, starting to reopen. They see the weather is getting better, and they want to be able to enjoy their city again. We have made progress fighting this virus. We are protecting the health of our city, and we have saved and will continue to save countless numbers of lives. We are getting through this period, but we are still in a deadly, pivotal showdown with this virus. That doesn't mean we are not working for what has to come next and what should come next and what we all will be praying comes next. We are working, and the province is working with us so that we can be ready to reopen based on the advice of our public health professionals. We are starting to see more people in our parks, but at the same time as they're there, they are doing much better at respecting physical distancing, and that's a very good sign. It means people have heard the message loud and clear and are taking personal responsibility in this war on COVID-19. We're seeing fewer and fewer tickets in our parks being issued and in our public spaces for failure to keep physical distance and use of park amenities, and that too is a good thing. Today, I spoke with executives of the Mount Pleasant Cemetery Group and with their provincial regulator, as well as with our own medical officer of health. I was in touch with them to assist in moving us towards reopening their grounds ahead of the Mother's Day weekend. This follows discussions they have had over a period of time with local councillor Josh Matlow. For a series of public health and safety reasons, which I understand, and consistent with gradual reopenings which seek to avoid crowd scenes, their reopening plans, soon to be confirmed, are not likely to include opening hours on Mother's Day itself, but will likely include opening hours on days either side of Mother's Day. I hope this will allow relatives to visit the resting place of loved ones and do so very near to Mother's Day in this very unusual year. And it may well be that other cemeteries and cemetery groups will choose to follow this lead and have such a phased reopening. Consistent with our approach to all other decisions like this, public health and safety must come first. And so I understand the decision that the Mount Pleasant Group is likely to soon announce, and on my own behalf and on behalf of Councillor Matlow, I thank that group for the careful and yet responsive way that they are proposing to deal with this matter. It's a further sign that we are moving forward. When visiting any cemetery, including Mount Pleasant, people will still need to keep their distance from others outside of their own family and their own immediate household, and respect existing limits on group sizes when visiting the cemetery, just as they are now doing in public parks. I am told that signage will be in place to remind people of this. It's a cautious step towards a post-COVID world, and I once again thank Mount Pleasant for taking it. Now, while High Park remains closed, we are moving very quickly through peak bloom, and I'm hopeful we'll have a very firm reopening date soon. I'm pushing for the park to be reopened as soon as it is safe to do so, based on advice from our public health professionals and from our park staff. I want to thank all of those very same staff members in both parks and public health, as well as Toronto Police, for their competent, professional handling of the entire matter. And I want to reiterate again my genuine thanks to the people of the City of Toronto, especially the local residents of High Park, near High Park, for their understanding and patience. The Bloom Cam is proving to be very popular pandemic viewing. Since going live on April 29th, just a couple of days ago, the Bloom Cam has been viewed more than 125,000 times by more than 57,000 unique viewers. In the first few days, people watched more than 17,792 hours of the Bloom Cam footage, and 94% of the viewers indicated they liked the live stream. On Sunday, May 4th, we ran 2 short live events. On Instagram, we had 600 plus viewers, and on YouTube, 400 viewers watching live these events put forward. And again, I want to thank those responsible for that content that made that experience just a little bit more special. So we're getting through this pandemic thanks to so many Toronto residents doing the right thing and taking physical distancing seriously and staying home as much as they can. Now more than ever, as we move towards the reopening and recovery period, we are going to be relying on residents to keep demonstrating that personal responsibility. That will be the key to a successful restart and recovery, personal responsibility. I know Toronto residents are up to this challenge, a hugely important part of tackling and continuing to tackle successfully the greatest single continuing challenge this city has ever faced. And now, for her daily report, we will call on our Chief Medical Officer of Health, Dr. Eileen Davila.
Thank you, Mayor Tory, and good afternoon, everyone. In today's update, there are 6,448 people infected with COVID-19 in Toronto. This includes 5,809 confirmed and 639 probable cases. There are 394 people in hospital, 105 of whom are in intensive care units. In total, we have lost 469 Torontonians to this virus. On behalf of the team here, I wish a speedy recovery to those who are sick and extend deepest sympathies to all those who have lost loved ones to COVID-19. As I've stated before, these data represent our friends, our family members, and our loved ones. In public health, we use these data to help us understand how an infectious disease, in this case COVID-19, is impacting and spreading in our community. An important component of that data story is to understand if COVID-19 is affecting certain groups in our community more so than others, so that we can then better inform prevention strategies. Emerging evidence from other jurisdictions suggests that COVID-19 is impacting some groups more than others. This includes certain ethno-racial groups and those with lower income levels. We have done some preliminary analysis locally that suggests similar trends in our city. It is important to note that this preliminary data was analyzed by small geographic areas and not at the individual level. In our analysis, we found that people living in areas that have the highest proportion of low-income earners, or areas that have the highest proportion of recent immigrants and high unemployment rates, had higher rates of COVID-19 cases and hospitalizations. These preliminary findings suggest that COVID-19 might be disproportionately affecting certain people in our city. But it is difficult to get a complete picture using area-level data. To strengthen our capacity to address this issue, my team is adding socio-demographic questions to our case management process. We will be asking all people who test positive for COVID-19 about their race, income, household size, Indigenous identity, and First Nation status. This will begin in the near future, after we have made the necessary changes to our database to capture this information. As I mentioned yesterday, as the weather gets nicer, I know we will all want to get outside. This is good both for our mental health and our physical health. And I've been hearing firsthand from people who wonder why other Canadian jurisdictions are beginning to relax their public health measures, while we are not doing the same thing. So I'd like to take a moment to address these comments. First, while our situation here in Toronto is certainly improving, other places, like British Columbia, for example, are at a different point in their outbreak than we are. We know that our colleagues out in BC experienced the peak period in their curve approximately 1 month sooner than us, and they are now seeing fewer COVID-19 cases than we are seeing locally. As a result, they have recently stated that they are considering ways to slowly ease or relax their public health measures. Unfortunately, in Toronto, we are not quite there yet. In Toronto, we have not yet seen a steady decrease in the number of new cases each day, nor in the number of new hospitalizations each day. In Ontario, communities outside the GTA are seeing less COVID-19 cases than we are in Toronto. This is not unexpected given our population size, and as I have stated before, the reality is that COVID-19 does not impact all communities in exactly the same way. In Toronto, we need to look at our own unique circumstances to inform how we reopen safely. We are Canada's largest city, with a greater density than others and a highly mobile population. While our local indicators suggest that COVID activity is slowing down in our city, we need to continue physical distancing measures until we see a steady decrease in the number of new cases and hospitalizations. We need to ensure that we do not undo the progress we have made with our physical distancing measures. When we start to see our local COVID-19 infections and hospital admissions declining, we can start to ease our restrictions and slowly begin to reopen our city. However, physical distancing will continue to be a part of our lives for the foreseeable future. I know that it is not reasonable to ask people to continue to stay inside, especially now that the nice weather is upon us. We have been actively engaging with our city colleagues in the transportation services and the parks, forestry, and recreation divisions, and considering what we can do to keep our residents active and moving as part of our recovery planning efforts. However, we need to be measured in our approach for reopening our city. We are already seeing other jurisdictions slowing down their reopening in response to their local situation. For example, we recently learned that the plans for reopening retail stores in the Greater Montreal area has been pushed back by 1 week. We have been successful so far in reducing virus spread in our city. We need to be careful to not undo what we've achieved together through your hard work and your sacrifices over the past several weeks. As we start to move forward, please do stay safe. Please continue to practice physical distancing when you go outside, and please continue to take care of each other. I'll now hand it over to Chief Pegg.
Thank you, Dr. Davila, and good afternoon. All aspects of EOC operations are continuing, and our teams are doing an extraordinary job of ensuring that critical and essential services are being provided without interruption. Today, I've been asked to provide an update with respect to our personal protective equipment levels. Our PPE inventory levels continue to remain stable, although we are seeing increased PPE consumption rates in both paramedic services and long-term care. This is as a result of increased demand and in response to some recent protocol changes relating to the use of both N95 respirators and face shields. I'm pleased to report that our recent delivery of face shields has successfully gone through our increased verification and quality assurance process, and we have now placed 45,000 face shields into active inventory. We also have more on order. Our present PPE inventory levels, based on our current consumption rates, are as follows. We have a 19-day supply of N95 respirators, a 509-day supply of surgical masks, 264-day supply of isolation gowns, and a 20-day supply of face shields. The City is continuing to source and manage PPE in support of our continuing response to COVID-19. As a City, we continue to provide the essential and critical services that our residents both need and rely on each and every day in Toronto. For example, our City's fleet services team has been and continues to be hard at work throughout the pandemic. Fleet services increased operational capacity in maintenance, fuel management, and support services to ensure that our frontline workers are able to continue to deliver essential and critical services both safely and effectively. They also continue to support the work of Shelter, Support, and Housing Administration by providing vehicles, drivers, and training to facilitate the essential transfer of clients. And they have led the design of physical distancing solutions for city vehicles and supported the design and execution of operational strategies for food banks and other community partner services with the support of various partners and stakeholders. I would also like to acknowledge and thank our division-specific fleet and mechanical maintenance services that are also supporting essential services around the clock. This includes the fire services, paramedic services, police service, and TTC, vehicle and equipment maintenance and repair teams. It is important to acknowledge the great work of all city divisions and agencies throughout this response. I have the privilege of witnessing the continuous collaboration and innovation that is at the forefront of the city's public service during these unprecedented times. In closing, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. For reporters on the line, we have Mary Ann Bedard from our Shelter Support and Housing Division, as well as Paul Raftis from Long-Term Care, should you have questions. The first question is to Brian Passafume from the Toronto Sun. Brian, go ahead.
Good afternoon. My question's for the mayor. Can you talk about how the pandemic has impacted tourism in the city and how tourism fits into the city's overall reopening efforts?
Well, it is something that's had a huge impact on the city in terms of employment, in terms of business that spreads itself through various sectors of the economy, evidenced by, for example, the fact that you could walk into the Sheraton Centre Hotel or any other hotel in the city right across the street and find absolutely no one in the lobby, find maybe 2% of the rooms occupied, and of course that spreads itself out through various different sectors. And I think that it'll be an important part of the reopening, but it will be very much governed not only by our own local public health considerations, but also by international decisions that are made. You know, quarantine restrictions presently apply at both ends of any trip that anybody wanted to take in most cases. Airlines are not flying at the moment. The border between Canada and the United States, one of the sources of the greatest number of visitors that we would have, those borders are presently closed. A number of the events, just out of prudence and in the interest of public health for this summer that bring tourists here, have been cancelled. So I'm not trying to present a gloomy picture, but I think as we reopen the tourism business, we're going to make every effort, I'm sure, to promote staycations by people who already live in this city and in this province, but we're going to have to be realistic about what we're going to be able to achieve, both for public health reasons and just the realities of business in that early period. But we'll be making a huge effort to restart that very important sector that employs thousands of people, not just in Toronto, but outside Toronto as well.
Now, just a clarification on that. Has there been any sort of talks about any sort of special events or anything? I'm not talking like something like SARS stock or something, but any sort of like a talk about an event to help bring tourists back to the city?
It's a part of the recovery and reopening framework is that there will be some events that really are going to focus on getting people to shop local, dine local, and sort of have them become more aware of the fact that you know, the shops and restaurants and so on are open again. And those plans are part of the mandate that are being taken on by Mr. Raffi on advice of Dr. Mowat again. So there will be plans that hope to get people out and about in their own city, much as we experienced after SARS. But the notion of international visitors or even visitors from the rest of Canada coming here and what will be done in that regard will be very much dependent upon public health and other kinds of business decisions that are made outside of Toronto and outside of Canada, for that matter, in many cases.
Okay, thank you. We'll go to Angelina King from the CBC. Angelina?
Hi, good afternoon. This question's for Dr. Davila. You may have heard Premier Ford in his update today blaming local health units for a drop in testing, not naming specific regions, said some are falling behind, but some are doing exceptionally well. Just wondering what you make of those comments and whether you consider testing to be a bit more of a provincial responsibility.
So thanks for the question. And as we've discussed several times through a variety of questions here, testing is in fact something that is under a provincial purview. And I believe that, you know, without having spoken with the Premier directly, I think he may have been referring to testing efforts within the realm of long-term care homes, which is also under provincial purview. So that being said, I would say that as a representative of local public health, you know, we recognize that success in managing this unprecedented health emergency will require multi-sectoral collaboration. And to that end, it's my understanding that local public health is prepared to step up and help out with respect to testing and respect to long-term care. Even though those are outside of our mandate, we're prepared to help in order to best protect the health of the residents within that system and the residents of the province writ large.
Thanks for that. Wondering how you might characterize testing within Toronto Public Health, if you can give us a bit of an update on numbers, maybe some challenges that might come into play.
Well, given that testing is actually within the provincial purview, I don't actually keep stats on the tests. They are being done as part of the healthcare system. And we certainly know that there are a variety of assessment centers, and there are certainly opportunities for testing to occur within the context of long-term care homes as directed by the province in order to best secure the health of those who are in that sector, whether we're talking about residents of long-term care homes or those who work within those settings. So I know that testing is certainly being made available, and I know that our provincial counterparts have made great efforts to increase testing capacity within the system so that those who need tests are able to get those tests in a timely fashion.
Okay, thank you. We'll go to Chanel Call now from CP24. Chanel?
Hi, Mayor. Sorry to stray from important COVID news today. Just want to ask you about these foxes. This has become a big attraction in the beaches. Just want to know whether the city is going to be doing anything more to protect the animals.
Well, I haven't had brought to my attention that anybody is abusing the animals or doing anything that would threaten them. Obviously, if that information came to my attention, I would want to see us deploy any possible resource that we could, including provincial resources in the natural resources area of their government to protect those animals. So I think people are keeping an eye on it. Again, we've urged people to leave the animals alone. Again, it's a different kind of physical distancing, but they should physically distance themselves from the foxes and from that little family of animals and understand that it's an important part of living in a great city that is conscious of its environment, that we should have wildlife that can thrive in the city, recognizing that this is not necessarily the best place for them to have their home, but that in the meantime, while they're there, we have to keep an eye out for them and take care of them. But I've had no indication at this moment in time whatsoever that I'm aware of that there's been any abuse or mistreatment of those animals.
I guess the question comes from some information yesterday that came to light that folks here in the beaches were saying they've seen people coming here late at night, in the middle of the night, and feeding the animals, trying to take photos with the animals. Now there's some gates up, and today I see there are bylaw officers here as well. But I think the concern comes from area neighbors who say it isn't being patrolled 24/7. Sometimes people are coming at odd hours to try to get close to the animals.
The bottom line here is these are animals in the wild. It's a tribute to our city that we have plentiful wildlife coming out of our ravines and in different parts of the city, and that people should understand these are not pets. These are animals that should not be fed by people. People should not approach them too closely, both for their own safety and for the safety of the animals. And so I hope that message will get across, and that if it doesn't seem to be getting across, we can look at other measures we might undertake. But it's difficult for us, given that the fact that they are wild animals and they're living in a big city, for us to to be looking after everything that they do or everything that is done around them. But I think if people again take personal responsibility for this, the animals can be safe. I suspect they will move somewhere else in due course, but we have to keep an eye on them in the meantime, and I will certainly try to keep apprised of how people are respecting those animals and their need to have some space as we go forward.
Okay, thank you. We go to Ben Spur now from the Toronto Star. Ben?
Hi there. My question's for the mayor. Mr. Mayor, you said a few weeks ago that figuring out how to safely operate the TTC will be one of the biggest challenges for the city as it starts to reopen. Other jurisdictions have done things like mandating that passengers wear masks, asking employers to change work hours so crowds on vehicles don't get too large during rush hour, putting down floor markings to tell people where to stand. Are those the kind of strategies the city will be implementing?
Every single one of those things and more are on the table and under active discussion. We are not presuming to have all the right answers here in Toronto for our transit system or anything else as we go about the task, Mr. Raffi and Dr. Mowat and others, of reopening the city properly and safely and in the interests of public health. So we're drawing upon ideas from elsewhere, and we're going to draw up the best plan for Toronto. And transit is a particular area of complication because obviously, by definition, you have groups of people together on different vehicles. And so all of those kinds of things are under active discussion. None of them as yet has been accepted because the plan hasn't been finalized as yet. but I can just assure you what we're wanting to do is make sure the service is available for people in a way that is safe and healthy and that doesn't pose undue risk of health or anything else to people as they use public transit, which we want them to return to doing as soon as possible during the recovery period.
And just to follow up, I think this is for Dr. Davila, but before this crisis, we of course would regularly see large crowds throughout the TTC network at stations and on vehicles. And in your opinion, will it be impossible for us to safely return to anything resembling regular transit service and the associated crowding until there is a vaccine for the disease?
Well, as I think we've just heard the mayor indicate, we have lots of options on the table, and we certainly are going to be looking at, that which is happening in other jurisdictions as we're all learning how to live safely with COVID-19 in our environments. This is not something that's unique to Toronto, in terms of the global situation. So I think we have opportunities to, come up with innovative strategies that make sense for us here in Toronto, but as well to learn from other jurisdictions as we all try to move towards recovery and seek to, restore activity and reopen our respective cities and jurisdictions.
Okay, thank you. We'll go to Lucas Meyer now from News Talk 1010. Lucas?
Thank you very much for taking my question. I was wondering, with regards to what the Premier was saying today about MLSE being in contact with him regarding, Toronto being a possible pod city for the season, saying that he had been in discussions with MLSE. So, Mayor, I'm just wondering if there's anything you can add to that, if there's been discussions between further discussions between MLSE and the city. What's the city's role in that, if so? And also, if there's any update on the Raptors practice facility. I know you had mentioned to stay tuned. So can you elaborate on a little bit on possible pod city for hockey and the Raptors practice facility?
There have been some very preliminary, very high-level contacts with respect to the possibility of some hockey games being played here, but it's something that hasn't been finalized by the National Hockey League, and certainly MLSE are very mindful of the fact that there would have to be substantial public health considerations taken into account as to the possibility even of those kinds of games being played here in Toronto. With respect to the Raptors, it is joint decision-making that is taking place as between the Government of Ontario and the City of Toronto, and those things are moving forward quite nicely, and I expect that there'll be some news to report on that in a way, again, that is going to be consistent with making sure that our team and our players can have not be put at a competitive disadvantage, but at the same time respecting completely the imperatives that we have with regard to public health and stopping the spread of COVID-19. And finally, just because it's out there a little bit, similarly, I've been contacted by the senior executives of the Toronto Blue Jays who are looking for some information at a very initial preliminary level with respect to the possibility of the Blue Jays at some stage, obviously dependent again upon information that has to do with the border and quarantines and public health, possibly being in a position to play some games, whether it's here or elsewhere. And so all of these things are under our active consideration because these sports teams have approached us, and we will let people know as soon as there are decisions that are made, but always placing public health first.
Thank you very much for that. And if you could also just point out what exactly, when you mentioned the Raptors facility, you mentioned that there might be some news soon, just when that could be there, but also, and I know this has been asked before, but just given where we are financially, has the city given any more consideration about formally asking the province to allow for a deficit? I know it's been asked before a few weeks ago, but I'm just wondering if there's been any more consideration about possibly going that route.
It's possible, though I think it's unlikely the City Council could itself request or direct me to ask the province for permission to run a deficit. I personally have no intention of making such a request. I don't believe it's the right way to go. I think that the other governments have an obligation to step up in a situation where the pandemic has caused serious revenue losses and substantial additional expenses to the City of Toronto to the tune of a minimum of $1.5 billion in 2020. And since we don't have access to the revenue sources, I mean, borrowing the money is not going to do any good because you have to pay it back. and how are we going to pay it back given the limited revenue sources that we have with essentially property taxes and land transfer taxes. So the real solution here is for the governments that have access to the real revenue sources, income taxes, sales taxes, corporate taxes, to backstop the city and backstop all the cities in Canada and in Ontario to make sure that we can regain a position of financial stability and well-managed finances, which we had before the pandemic, and so that we can continue to deliver to the people of Toronto the kinds of services they absolutely positively rely on every single day: police, fire, paramedics, parks, roads, transit. These are the things we do. And so I'm looking forward to continued discussions with those other governments about how they can help us in a manner in which I think they're absolutely obligated to do.
Okay, thank you. We'll go to Tracy Tong now from CTV. Tracy?
Hi there. This question is for Dr. Davila, and this is a follow-up regarding your answer on testing being a provincial purview. On that note, do you believe that the Premier's comments then blaming local health units for a dip in testing was unfair? And the numbers that he did give were more in line with the overall testing, and I believe not just for long-term care settings.
Okay, so thank you for that. I think that, you know, as local public health, we have been working very hard, as you can well imagine, over the last several weeks in order to address the COVID-19 emergency. Most significant emergency we've experienced here as a city, and I would dare say across the province. So significant effort. And when we think about testing, which is actually within the purview of the province, for any role that we play as local public health in supporting that, because it's outside of our purview, it is an extra step that we're doing, and it is a measure of stepping up in this very important situation, in this unprecedented global health emergency. So I think that we've seen that kind of partnership, we've seen that kind of collaboration, not only from public health, but from our acute care partners, and certainly for those who are within the long-term care system. So that's how I characterize the situation, and I think that it's important for the people of Toronto, and you know, if I can speak on behalf of my colleagues around the province, I think I think it's important that the people of the province recognize that local public health is interested in collaborating and being supportive, particularly in these situations where collaboration is most needed to effect a response.
Thank you. And I think you had mentioned, but very briefly, that you have not received a call from the province. We just heard from Ontario's Chief Medical Officer of Health saying that they are reaching out to local medical officers of health who may perhaps have been underperforming in their eyes in terms of testing. You not had that conversation is the question.
So actually what I had mentioned was that I hadn't had specific conversation with the Premier. But again, what I will say is that as local public health, we are interested certainly in collaborating with all of our partners, the province, acute care and long-term care, in order that whatever testing needs to be done, whatever service needs to be provided, even though those services may be outside of the traditional purview of local public health, we recognize that this is an unprecedented global emergency, and we're willing to step up to the plate to do what needs to be done to protect the health of the residents we serve.
Okay, thank you. We'll go to Mark McAllister now from City News. Mark?
First and foremost, to Dr. Davila, if you could, just further what you had said earlier about how the virus is affecting some groups perhaps more than others. First question, and then perhaps a follow-up, is why haven't we heard this data before now? Why has it taken it so long? And second to that, what more can you tell us specifically about the initial data that has come forward to this point? Any specific numbers or percentages?
So thanks, Mark. I think some of our challenges have been that we have been busy responding to this very significant emergency. And as I've indicated through a number of different interviews and you know, a number of different presentations at this table, we have been focusing on a wide variety of activities, everything from case and contact tracing, which we know is very, very labor intensive. We've provided a hotline service in order to answer questions, and we've been supporting a variety of different sectors, as we've just been remarking now, whether it is long-term care homes and managing outbreaks within congregate settings, or collaborating with acute care partners on, assessment centers and the like. So we've had a wide range of activities that we've been putting our efforts into. That being said, providing analysis on the data is an important component of what public health does, and I'm hoping that you're seeing that we're trying to provide that service so that we can understand what's happening here in our city and inform future prevention efforts. Because again, that's the role of public health. We really try to focus on prevention whenever possible and as much as possible, because we know that that's the most effective intervention that's available to us as public health. So what kinds of data can you expect to see from us in the future? As I spoke to in my remarks, this is a very high-level analysis that we've conducted thus far, and it actually is only done on area-level data. As we update our information system, you'll recall that we introduced a new information system to help us better manage cases. We are updating that system as we speak, and we should soon be introducing this method of collecting socio-demographic information on our cases. As we get more and more data, we will be able to report out to the public on that analysis that is specifically done at the individual level and should inform future prevention efforts and inform the public around how the COVID-19 outbreak has impacted specific subsegments of Toronto.
Thank you. A question for Mayor Tory now, if you would. You've got a licensee at the St. Lawrence Market right now, in the Sunday Antique Market, who is concerned right now that they are being charged rent by the city for the venue that they only occupy once a week on Sundays, but they're not able to operate, unlike the other vendors at St. Lawrence Market who are considered essential services. As a result, they're being quite critical of the city, saying it's a double standard to ask other landlords to offer some leniencies, and the city isn't doing so itself. Why would the city require the antique market to pay for space it's not allowed to use?
In actual fact, they have been offered a deferral of the rent for a period of 3 months. That's my understanding. And in actual fact as well, discussions are ongoing with them if there's a better solution that we can find, because I think that's entirely consistent with what I've been suggesting other landlords should do, which is to reach some kind of a reasonable accommodation with commercial tenants so that they can carry on in business and so that it reflects the fact that they're not able to carry on business in the normal course at this time. And so I certainly want to see those discussions reach a successful and agreeable conclusion. I trust they are continuing, because that's what I've been informed, and I'll certainly be interested to see that fair treatment is arrived at, fair treatment both for the tenant in this case and for the city for a building that is owned and financed by the taxpayers.
Thank you. We'll now go to Matt Bingley from Global News. Matt?
Hi, Dr. Davila. On the new data that you're tracking, I'm just wondering how many people that you've looked at, how many cases rather, that has informed this so far, and if there's any opportunity to go back and look at some of the older cases that have been resolved or haven't to help get a more fulsome picture of this.
So just to be clear, Matt, we're not yet tracking those new data. We are making the necessary changes to our information system to allow us to collect those data so that we can then report on them. Whether we can go backwards and look back at the existing cases that we already have, I'll have to take up with the team, but certainly you can appreciate that we're interested in understanding the socio-demographic analysis and providing the residents of this city with that knowledge. One, so that they're aware, and two, we're interested in ourselves as public health in order that we can better inform our prevention strategies on a go-forward basis.
Sorry, could I just get you to clarify then, if you're not tracking the data yet, then how are you able to come to these conclusions that you stated at the beginning?
So that's an excellent question, and it's a little technical, but I will try to put it in pretty straightforward terms. What we know is we have data in respect of certain geographic areas of the city. And we know that certain areas of the city, for example, are characterized by populations that are of higher income status, or that there are certain areas of the city that have higher proportions of recent immigrants, for example. So using that area level data and combining that with our understanding of where COVID-19 cases are emerging or where those who are being hospitalized with COVID-19 are coming from, we can provide that high-level analysis. However, it is not as precise, nor does it give us the depth of information that you would get if those data were collected on an individual case-by-case basis. That's why we're making this change.
Okay, thank you. We'll go to Francine Copen now from the Toronto Star. Francine?
Well, good afternoon. My question is for Dr. Davila. Dr. Davila, I wondered if you could explain what COVID testing the province is responsible for and what COVID testing Toronto Public Health is responsible for.
So Francine, actually the province is responsible for all COVID testing.
Okay, but you mentioned TPH doing testing in long-term care homes?
So what we've been asked to do is to work with partners in long-term care and with partners in acute care who are supporting the efforts in long-term care to pull together data on testing and to ensure that testing is actually happening within those settings. However, testing and long-term care itself is under provincial purview.
Okay, thank you. Those are all my questions.
Thank you, Francine. Okay, final question is to Jeff Gray from the Globe and Mail. Jeff?
Oh, hi, yes, thanks. Just wanted to pick up on that clarification there from Dr. Davila. So you're saying it is Toronto Public Health's role to ensure testing is occurring in long-term care homes in Toronto. Is that right?
So traditionally, we are not responsible for either testing or for long-term care. So testing itself is under the provincial jurisdiction, and oversight of long-term care homes is also under the provincial jurisdiction. We find ourselves, however, in the context of an unprecedented global health emergency, and we know that one of the populations most affected are those who are actually residents within long-term care home settings. So as a result, healthcare partners and health system partners are actually collaborating together in order to support a series of actions to best protect the health of those who reside within long-term care homes and also those who work there. So acute care partners have stepped in. They're providing support on infection prevention and control. They're providing supports on testing within the context of long-term care homes. And as local public health, we're supporting those efforts. So it's a combination of acute care, local public health, and long-term care homes themselves that are working towards ensuring these protections are in place, that the testing is happening, the testing that's been directed by the province, so that we can actually put into effect strategies to protect those who live in long-term care and those who work in long-term care.
And are you then doing enough to ensure that the people in long-term care, all these people that we've been told are going to be tested, are being tested? Is Toronto Public Health then, in your view, doing enough, doing its part to ensure that that's occurring?
Yes, in conversation with my team, we have a fair number, as you can well imagine, of long-term care settings in our jurisdiction and a number of partners that are involved in order to effect this testing strategy as directed by the province. And I can assure you we are doing everything we can to make sure that this is done in a timely and effective manner.
Okay, thank you very much, everybody, and thank you for tuning in, and we will talk to you again tomorrow at 3:45.